Welcome to this explainer. Look, when it comes to healthcare in your retirement years, what you don't know can literally cost you. Today, we're cutting through the dense government jargon and breaking down original Medicare into plain, simple English, giving you the absolute essential guide so you can avoid making incredibly costly mistakes. So let's just dive right in with a quick question. If someone walked up, tapped you on the shoulder right now, and asked if you could explain the exact difference between Medicare Part A and Part B, could you actually tell them? If you're drawing a blank, trust me, you are definitely not alone. Get this, nearly 60% of American seniors fundamentally misunderstand what these two parts actually cover. And listen, that's not just some harmless trivia. That confusion is actively costing folks hundreds, sometimes thousands of dollars every single year. You pick the wrong plan, you miss a critical deadline, and suddenly you are paying straight out of your own pocket for things that absolutely should have been covered. So here is how we are going to fix this today. 1. The cost of confusion. 2. Part A, hospital coverage. 3. Part B, doctor coverage. 4. A side-by-side comparison. And 5. The critical enrollment window. Section 1. The cost of confusion. What is Medicare? All right, before we pull it all apart, let's do a super quick refresher on what original Medicare actually is, just to make sure we're all on the same page. It is a federal health insurance program designed specifically for folks 65 and older. And just to be crystal clear, this is not Medicaid, which is based on income. Medicare is based primarily on your age. Think of original Medicare kind of like building a house. Part A is your foundation, and Part B, that makes up your walls and roof. You absolutely need both to have a complete, secure home to protect your health and your wallet. Section 2. Part A. Hospital coverage. The foundation. Let's pour that foundation, starting with Part A. If you only remember one word for Part A, make it hospital. This part is designed to step in for the really big, serious medical events. We're talking inpatient hospital stays, meaning your room, your meals, nursing care, the whole shebang if you are admitted. But it doesn't stop there. It also covers up to 100 days in a skilled nursing facility if you need rehab or wound care after a hospital stay, plus hospice care, and even certain home health care services if your doctor orders it. Now, here is the absolute best part. $0. Yep, for most Americans, the monthly premium for Part A is completely free. As long as you or your spouse worked and paid Medicare taxes for at least 10 years, which is 40 quarters of work, you don't pay a single dime per month for this massive foundation. Almost everyone turning 65 today easily qualifies for this. But, and you'll really want to hear this, free premium absolutely does not mean zero out-of-pocket costs when you actually get sick. For 2026, there is a $1,676 deductible per benefit period. Basically, if you have a medical emergency and get admitted, you have to pay that first $1,600 and change before Part A even thinks about picking up the tab. To put that into perspective, let's look at Harold. He's 68, had a heart attack, and spent 5 days in the hospital. The total bill? A jaw-dropping $42,000. Wow. But because Harold had his Part A foundation, Medicare stepped in and covered over $40,000 of that bill. So Harold's massive life-ruining debt dropped all the way down to just his deductible of $1,676. That right there shows the true financial power of Part A. Section 3, Part B, doctor coverage, the walls and roof. Okay, the foundation is set. Let's throw up the walls and the roof with Part B. If Part A is the hospital, Part B is basically everything outside of the hospital. The magic word here is doctor. It focuses entirely on your regular, everyday medical care. So every time you go see your primary care doc or a specialist, Part B helps pay. It covers outpatient stuff like lab work, MRIs, and X-rays. Crucially, it covers preventative care, like annual wellness visits and cancer screenings for literally zero cost to you. It even handles mental health services, medical equipment like wheelchairs, and emergency ambulance rides. Now, unlike Part A, Part B requires a monthly premium. For 2026, the standard premium is $185 a month. I should throw in a quick caveat here, though. This is income dependent. High earners get hit with something called IMIA, an income-related monthly adjustment amount. And depending on your income, that could push your monthly premium up to around $628. And yep, just like Part A, Part B has its very own deductible. In 2026, it's an annual deductible of $257. It's relatively small, sure, But you do have to pay that $257 first before Medicare steps in to help with your doc visits and outpatient care for the year.
Once you hit that small annual deductible, a very specific cost-sharing split kicks into gear. Medicare is going to cover 80% of all approved medical costs. That leaves you responsible for the remaining 20% straight out of your own pocket.
Let's see this in action with Dorothy. She's 71, her knee is acting up, and she gets an MRI that costs $1,200. Since she already met her deductible for the year, that 80-20 split activates. Medicare pays its 80%, which is $960. Dorothy covers her 20%, coming out to just $240. Without Part B, she'd be stuck holding that entire $1,200 bag. And honestly, that leftover 20% you're responsible for, that is exactly why so many folks buy a Medicare supplement or Medigap plan. But hey, that's an explainer for another day.
Section 4, Side-by-Side Comparison.
Let's put these two right next to each other, because it makes it incredibly obvious why you need both parts. Here's a super simple memory trick for you. Part A is for admit, as in admitted to the hospital. Part B is for everything beyond the hospital. Make sense? You absolutely need both. Have only Part A? Great, you're covered in the hospital, but regular doctor visits will cost you full price. Have only Part B? Doc visits are fine, but a hospital emergency will bankrupt you. Together, A and B build your completely secure healthcare house. Section 5, the critical enrollment window.
All right, so we know what it covers. Now we transition to exactly when you need to sign up because the clock is loudly ticking. And this right here is where people make their most expensive mistakes. You have a strict, highly regulated 7-month window to sign up around your 65th birthday. It opens exactly 3 months before your birthday month, includes the month of your birthday, and slams completely shut exactly 3 months after.
Miss this window and you are going to get punished financially. You will face a 10% lifetime penalty on your Part B premium for every 12 months you delay. That means your monthly healthcare costs go up forever. Let's say you mess up and delay signing up by 2 years. Your standard premium gets hit with a permanent penalty that's going to cost you over $444 extra out of pocket every single year for the rest of your life. Seriously, do not wait. So, to quickly sum up our explainer today, you absolutely need both Part A and Part B for a solid health foundation. Part A covers the hospital and is generally premium free. Part B covers your doctors and outpatient care for around $185 a month. And most importantly, you have got to enroll on time at ssa.gov during your 7-month window to protect your finances from those lifelong penalties. We've covered the absolute essentials today, giving you a solid grasp of how Part A and Part B work together. But I want you to ask yourself something. What happens to your hard-earned life savings when you face the surprising, everyday medical needs that original Medicare simply refuses to cover? Knowing what's covered is vital, but knowing what is not covered? That could literally be the difference between a relaxing retirement and total financial ruin. Thank you so much for joining me for this explainer. Take good care of yourself and keep learning.